So at our rehearsal the other night, one of our retired cardiologist, was going, what's going on, and I told him what I was doing, and he goes, oh, that doesn't work. No, there's no evidence at all. And then I said, well, yeah, I mean, Barb had it 5 years ago to her low back. She was a surgical candidate.
Yeah.
And my partner's husband, same thing.
Mm-hmm.
Incredible response
Yeah.
from this clinic.
Yeah.
And so I started doing that with him, and he was like, no. He was just like hard ass about it.
Right.
So, here, doctor, what would you say?
Yes.
I mean, I did my best to retaliate a little bit.
Unfortunately, that is very common in the medical community.
Mm-hmm.
And it's not just cardiologists who don't, necessarily, they read about their own stuff, right?
Yeah.
But even orthopedic surgeons are very poo-poo about this to a certain extent. I was under a very beneficial and optimistic partnership with my father, who was very open to this, even though he's an old school orthopedic guy.
Yeah.
I started to expose him to the literature and showing him what I think we could do from crossing over with patients and how we could help them. And once he sort of saw that, it was like, why would you not do this, right?
Yeah.
But it's not just anecdotal between the two of us.
Mm-hmm.
The amount of studies that have come out, particularly for PRP starting about 10 years back, has gone up almost 4,000-fold, right? I mean, there's thousands of studies that come out on a monthly and yearly basis that are looking at these particular things.
That's great.
You cannot open an orthopedic journal these days without there being some large section having to do with orthobiologics and especially in combination with surgery.
Yeah.
So,
oh, right.
Yeah, so I don't even have to argue from my standpoint, right? I can just say, look at the American Journal of Medicine, of sports medicine. Look at JBJS over the last 10 years.
Yes, reputable resources.
Big sources that have all of these things. Now, if you want to get into an argument of particular areas and how well these things work in particular areas, I will have that argument, and that's very fair. And so an example for that is we have very good high quality data, randomized controlled trials of using PRP for tennis elbow. Pretty much across the board it is very useful and honestly should be one of the first go-tos before you ever talk about doing surgery. But the data for using just PRP for Achilles tendon problems, not very good. Don't have great outcomes for it.
Yeah.
So you have to basically be in my position and keep up with the literature to be able to know those are just tools, again.
Yeah.
How am I going to best utilize the tools in specific areas? So when I have somebody that comes into me that has Achilles tendon problems, we're looking at more of those advanced type of procedures, usually utilizing the cell therapy and lipo or BMAC with the PRP, because we just know that the PRP alone is probably not enough.
Yeah.
So you have to be able to know sort of the intricacies of that data to be able to know what works, what does not work. Yeah. So there is no blanket statement of this just doesn't work.
Yeah.
That's not correct.
It's like, well, yeah, let's take a look at the doctor who did the PRP on your ankle, and it was never going to work.
Right.
So let's look at that one. Right. That's why.
Correct.
Yeah.
Correct. And it goes back to what we talked about with you. Would you have gotten some benefit from me just injecting PRP into your joint space? Potentially. But you had pretty extensive disease, and there were other things that were just yelling out that they were a problem.
Yeah.
That's why you and I had that conversation and that communication together to decide we need to up this a little bit to give you a better chance, right? And I think that's kind of my best thing that I can talk to other docs about, right? And I usually try and keep it cool, have some confidence, and I know that, yeah, exactly. I know that the literature that is there to back me up.
Yeah, that's fantastic. That's what I'll be telling him next time I see him.
There you go. There you go.
The literature.
The literature.